Infection control and isolation. The chain of infection includes the presence of an infectious agent, the agent's available reservoir, the portal of exit from the reservoir, the mode of transmission from the reservoir or the agent's home to the host, and the portal of entry into a susceptible host. Any break in the link of the chain can prevent the development of an infection. An infectious agent is something that contains a bacterium, fungus, virus, parasite, or prion. The reservoir is the home or the habitat of the infectious agent. Where does it live, grow, reproduce, and replicate? The reservoir can be an animate or an inanimate object. Animate reservoirs or animate objects are people, insects, birds, and animals. Inanimate reservoirs are contaminated soil, water, food, medical equipment, IV fluids, and feces. The portal of exit is the route the infectious pathogen takes to leave the reservoir. The mode of transmission. There are various modes that may be used to move bacteria, virus, fungi, parasites, and prions from place to place. These can be contact, droplet, airborne, vehicle, or vector-borne transmissions. The infectious agents transmitted by one or more modes with various routes depend on the exact agent. The portal of entry is what is required for the individual to get an infection. This provides a place for the infectious agent to enter the individual to replicate or for its toxin to act. An example would be a break in the skin or a mucous membrane. The susceptible host. This is what is required for the infectious agent to attach and become the new reservoir for the infection. There are various modes of transmission. Pathogens are also transmitted through vectors that could be insects or vehicles like contaminated water. Droplet transmission occurs when infectious droplets travel through the air and contain the mucosa of a host. Airborne transmission occurs when small particles in the air move into the airspace of another individual and it carries the infectious agents to the other individual. These particles will remain in the air and can travel long distances. Vehicle and vector-borne transmissions involve the transfer of pathogens through other various methods. Vehicle involves transmission from contaminated items to multiple persons, such as mosquitoes and rats are common sources of vector-borne transmissions. While these themselves are not infected with the pathogen, they carry these microorganisms from one place or one person to various individuals. The skin is the body's largest organ, and it is the body's primary physical defense mechanism. The skin has three major functions: reduce the loss of water, protect against abrasion and microorganisms, and provide a permeable barrier against the environment. Mucous membranes secrete mucus to protect the body from foreign invaders. Tears, sweat, and white blood cells aid in removing waste from the body. Two types of immunity are nonspecific immunity. This is maintained by neutrophils and macrophages. These are types of white blood cells and work as phagocytes. Phagocytes eat and destroy microorganisms, which helps protect the body from harm. Both neutrophils and macrophages are released during the inflammatory response. Specific immunity is the work of antibodies or immunoglobulins and lymphocytes. The antibodies bind to the infectious agent and activate white blood cells and their complements to destroy the infectious agent. The basic steps of inflammation are, number 1, recognition of harmful stimuli by pattern receptors. These are located on the surface of cells. 2, activation of the inflammatory pathway. 3, release of inflammatory markers. And 4, recruitment of inflammatory cells. Many processes trigger the inflammatory response, and it is divided into two categories, infectious and non-infectious. The infectious inflammatory response triggers include viruses, bacteria, and other microorganisms. The non-infectious inflammatory triggers are plentiful. These will include burns, frostbite, foreign bodies, trauma, injury, or radiation. Stages of infection. Number 1, incubation. This is the first stage. The individual may not feel ill or have any visible manifestations, but there are changes in pathology that occur. This will last from the time the individual is exposed to the infectious agent until the first symptom appears. The prodromal phase is number 2. This begins by having initial manifestations as the infectious agent is replicating. There are non-specific symptoms that may be noticed: fever, body aches, poor appetite, and malaise. The third stage of the infectious is the acute phase. This is when the infection becomes quite obvious. During this time, the stage of infection is considered severe. The fourth stage is the period of decline. During this stage, the number of infectious agents decrease, the individual begins to feel better, and they are regaining strength and function. The last stage is convalescence. This is when the individual returns to their previous state of health or a new state of health. Types of infections are categorized into two according to their location. They are either local or systemic. Local infections are confined to one area of the body and can be treated with topical antibiotics and oral antibiotics. An example might be a hangnail. A systemic infection often begins as a local infection, but it moves into the bloodstream and it infects the entire body. Systemic infections require intravenous antibiotics and careful monitoring. Antimicrobial soap is used for regular hand washing along with warm water. This removes dirt and debris from surfaces. Soaps may become contaminated, cause the drying of skin on the hands, and cause an increased bacterial load on the skin. The World Health Organization has determined that proper hand washing for an individual is when the individual will sing the song "Happy Birthday to Me" 2 times. Alcohol-based sanitizers are used on the hands and rubbed until dry to cleanse the hands without water. These products must contain 60% alcohol solution to be effective against gram-positive and gram-negative bacteria, many viruses, and fungi. Medical asepsis is a clean technique used to define the reduction of disease-causing microorganisms. An example would be a doctor's office. Surgical asepsis removes the entire infectious agents. Staff performing surgical procedures must use surgical asepsis to prevent the transmission of any pathogens, thereby protecting the individual from infection. Surgical asepsis ensures that items like gloves and equipment are sterile. These items that are sterile have no microorganisms or spores present. Sterilization is the cleaning of instruments and removing all microorganisms, including bacterial spores. This may be accomplished by steam and then dry heat, with ethylene oxide gas, or with chemicals, depending on the item. Disinfection cleans instruments and removes almost all microorganisms, but does not remove spores. Standard precautions are also known as universal precautions. This describes the infection prevention practices that are applied to all clients that enter the healthcare system. Nurses use standard precautions to protect themselves and their clients from blood, body fluids, secretions, excretions, non-intact skin, and mucous membranes. Contact precautions intend to prevent transmission of infectious agents by direct or indirect contact. These can be examples: vancomycin-resistant enterococcus, Clostridium difficile, norovirus, and other intestinal tract pathogens, and RSV. The nurse caring for contact precaution patients should don PPE, gowns, and gloves, and the clients on contact precautions are placed in a private room with the single client only. If there are not enough beds or space, cohorting is an availability for individuals. This is when clients are placed in a room with another client who has a similar diagnosis. For droplet precautions, the nurse will don a surgical mask when entering the room or coming into close contact with the individual. This individual should have a private room. When leaving the room, the client will wear a mask to prevent the transmission of the infectious agent to others. Airborne precautions require assigning a private room with the door remaining closed. Airborne infection isolation rooms, also known as negative pressure rooms, are preferred. These rooms are built with special air handling and ventilation to provide negative pressure relative to the surrounding area. Caring for airborne precautions, an example would be active pulmonary tuberculosis. The nurse must wear a respirator or an N95 mask or higher to enter. N95 masks or respirators are specially fitted to the individual that is wearing them. Protective isolation is for the immunocompromised individual after receiving an allogeneic hematopoietic stem cell transplant, and they need special isolation environment during the first 100 days after the transplant and longer if they experience complications. Protective environment or protective isolation can also consider a cancer individual who has had chemo and radiation. There are 4 major healthcare associated infections: central line associated bloodstream infections, known as CLOBCs, catheter associated urinary tract infections, CAUTIs, surgical site infections, SSIs, and ventilator assisted pneumonia or VAPS. As nurses, we use infection control bundles or care bundles. These are guidelines for practice that, when bundled together, assist to prevent healthcare-associated infections. Infection control bundles are used worldwide to improve the safety of the clientele and decrease mortality. Multi-drug resistant infections are caused by multi-drug resistant organisms. If bacteria are resistant to one or more classes of the existing antimicrobials, then they are categorized as a multi-drug resistant organism. Personal protective equipment is vital for the nurse to use in the healthcare environment. Gloves are made from latex, vinyl, or nitrile to protect the hands from contamination and protect clients from being infected. Gloves are used with potential for any direct contact with blood or bodily fluids, non-intact skin, mucous membranes, or potentially infectious materials. Gowns are used if there is a potential for contact with infected material or for blood or body fluids that may penetrate the uniform and contaminate the individual. Masks, goggles, and face shields are used as needed when on standard or droplet precautions. The nurse should wear a mask when assigned procedures that require sterile technique. Removing personal protective equipment is done in a specific order. Gloves are removed first. Next, the goggles or face shield is removed. Then the gown is removed, and then the mask. Finally, the individual will perform hand hygiene immediately after exiting the room.